Okay, Jim, you may start. Good.
Yeah. Okay. Liver. So liver is a triangular shaped type of organ and is part of the digestive system. So the digestive system that actually help us to break down the food we eat and convert nutrient into substances that our body needs. So the liver weighs about 3 pounds, about 1.4 kilogram, and it is located in the right upper abdomen below the diaphragm, just under our rib cage. It's the second largest organ in the body. So you may wonder which one is the largest organ in our body. Yeah, skin. So look at the bottom right picture. One of the main function is to filter blood. So blood flow to the liver from two sources. From the top of the liver is a hepatic artery, and from the bottom of the liver actually come from the intestine is actually the hepatic portal vein. Yeah. So in the liver, there are thousands of small, tiny processor unit called lobule, which act like a small factory that do the sorting, processing, and storing. So there are about 500 vital liver function. So their main function are as follows: bile production and excretion. So meaning they make bile to help in digestion and to break down the fat in the intestine. So the next one is excretion of bilirubin, cholesterol, hormones, and drugs. So bilirubin is a yellowish substance in your blood. It is the waste product from the breakdown of the red blood cell. Next is the metabolism of fats, proteins, and carbohydrates. So the liver actually involved in the metabolism of nutrients. So actually it receives those digestive products in the form of glucose, amino acid, fatty acid, and glycogen. Next is the enzyme activation. So ALT, such as ALT, AST, GGT, these are the enzymes in the liver. So all these enzymes are protein that actually speed up the chemical process in our body. This chemical reaction include producing bile and substances that actually help your blood clot, breaking down food and toxin and fighting infection. Yeah. So next is a storage of glycogen, vitamins, and minerals. Actually, liver will store all this for future use. So the excess sugar is stored in the form of glycogen. So when the body needs more energy, liver enzyme will actually convert the glycogen to sugar and send it to our body. Yeah. The next function is the blood detoxification and purification. So for medication and drugs, these are the toxins that need to be secreted out of the body. So liver will actually monitor those toxins from the incoming blood from the intestine and convert those toxins to a harmless substances and remove it to the kidney. Yeah. So because our liver perform a lot of essential life sustaining function, so we cannot live without a liver. Yeah, but we can live with part of it. So many people can actually function well with just half of their liver, and the liver actually can actually grow back in full size within a matter of months. Yeah. Yeah. Mm. Sorry. Sorry. Don't go live. Mm-hmm. Sorry for delay. There's a technical glitch here. Yeah. Mm. Yeah. Okay. Now let's look at some data. So liver disease. Yeah. So liver disease account for approximately 2 million deaths per year worldwide. Yeah, over 1 million is actually due to cirrhosis, and another million is actually due to liver cancer and acute hepatitis. So this is based on the data in 2010. So cirrhosis is a late stage of scarring of the liver after fibrosis. So later we will show you all the stages. Um, chronic liver disease is a major health burden to the society. So estimated to be the fifth most common cause of death after heart disease, stroke, chest disease, and cancer. As for Singapore, the 5-year data between 2007 and 2011 shows that cancer death caused by liver cancer ranked third for men and fifth for women. So there are various types of liver disease from hepatitis A to E. So the two most common liver diseases are chronic hepatitis B virus infection and fatty liver. And hepatitis B virus is actually passed from person to person through blood, semen, or other fluid. Okay, but do take note that it doesn't spread by sneezing or coughing. Yeah. So fatty liver disease is actually caused by uh, any of the following. Okay, too much consumption of alcohol, a combination of lifestyle factor, for example, the unhealthy lifestyle like eating fast food and food with high sugar and salt, and lack of exercise. So this lack of exercise will actually lead to so-called obesity, and also consume too much alcohol regularly. So if this continue throughout the years, fat would actually build up and accumulate in the liver. So fatty liver, in fact, is a layer of fat accumulated around the liver. Yeah. It's progress progression of a liver disease is actually started when liver is get inflamed. So if a person having a viral infection, yeah, with alcohol abuse, having unhealthy lifestyle, okay, such as staying up late or lack of exercise that actually lead to obesity, just I mentioned, and all these factors may actually lead to liver disease and damage. So damage from the liver disease can occur in several stages, which actually increasingly affect the liver function, which means the liver function will get deteriorated. Yeah. The early stage is inflammation. All this time the liver is enlarged and inflamed. Yeah. The next stage go to is fibrosis. Fibrosis is when the scar tissue uh, uh, begin to replace the healthy tissue in the inflamed liver. So liver function at this time will be slowly get deteriorate. So when the condition get worse, it actually become cirrhosis. So at this stage, several scarring has already built up, making it very difficult for the liver to actually function properly. So next will be the end stage liver disease. Yeah, at this stage, liver function has deteriorated to the point where the damage can't be reversed, other than with a liver transplant. So as for liver cancer, it is actually caused by the development and multiplication of those unhealthy cell in the liver. It can, for this liver cancer, actually can occur at any stage of liver failure. People with cirrhosis, okay, in particular, are at a higher risk of getting this liver cancer. Yeah. So the sign and symptom of a liver disease as follow. First is the skin and eyes appear to be yellowish like jaundice. This happens when you have excess amount of bilirubin circulating in the bloodstream, causing a yellowish appearance of the skin and the white of the eyes. Okay, at the same time, you may also have itchy skin. Yeah. The second one is ascites. So this is a condition where excess fluid in the space, okay, between the abdominal organs and skin. That's why you feel abdominal pain and swelling. So as a result of this build up, okay, in this area, build up of this so-called fluid in the area, you actually experience pain and swelling. And ascites is the most common complication of cirrhosis. Yeah. That we actually look at the color of the urine and stool. So dark urine color could be sign of a bowel that is blocked. Yeah. The normal color of a urine should be pale yellow. So do take note that if your urine is always dark orange or brown in color, in the darker color, it could be due to too much bilirubin build up. And because of this, bilirubin is supposed to bind with the bowel, okay, and move through the bile duct into the digestive tract so that it can actually clear away, eliminated from the body. Yeah. But now it end up leak to the blood and urine. That's why you got the color a bit dark. Yeah. So as for the stool color, the normal healthy color should be brown. So when it become pale in color, that means that the liver doesn't make bile normally, or the flow from the liver is blocked. So the pale color of the stool often happen along with yellow skin, jaundice. Yeah. So with the awareness of the above symptom, now we need to understand what the complication of the liver disease. Yeah. So as a result of chronic inflammation in the liver, the complication will be fatty liver and hepatitis. Yeah. So liver has permanent scarring due to long-term damage. It may actually end up having liver cancer or liver failure, which is irreversible. Yeah. Now we look at the cause. So the causes of the damage could be one of the following. Yeah. The first one is hepatitis A, B, C virus. Hepatitis A is actually transmitted via food contaminated with A virus. Okay. Example, the food handling is not clean. So this will actually get the food contaminated. Yeah. And hepatitis, this hepatitis A is actually through the so-called food handling or personal hygiene is not practiced. So for hepatitis B and C are through direct blood-to-blood contact with an infected person. Yeah. The second cause is related to alcohol, yeah, drug and medication, obesity. Third would be the autoimmune issue that causes hepatitis. Yeah. Next. So we look at test and diagnosis. So to test and diagnose the liver problem, a group of so-called blood tests for the profile liver, okay, can be used to diagnose the liver disease. So for the first one, ALT, SGPT, and AST, SGOT. So there's so-called the number should not be actually greater than 40 units per liter. So these two are the enzyme. They are actually used to identify liver disease or damage, such as hepatitis virus infection. Yeah. So the third one, ALP or so-called GGT, should not the number should not more than 15 units per liter. So high level means that the bowel is blocked. Yeah. So the next one would be bilirubin. The number should not be more than 26 micromole per liter. So high level means that liver having a problem. Yeah, because bilirubin is a waste product from the normal breakdown of red blood cell and is supposed to clear away. And this bilirubin pass through the liver and is supposed to excrete in stool. Yeah. So another blood test is to test the albumin. So this is to determine how well the liver is working. And lastly is the test for antibody for the hepatitis viruses A, B, C. Yeah. Next. Okay, how can we protect our liver? Yeah. So there are a few ways that we can actually protect the liver. First one is to reduce the alcohol, or best to stop alcohol completely. Also avoid self-medication. Okay, some people like to do self-diagnosis and take medication without consultation of doctor. So this one try to prevent it. So the reason is because potential risk of a drug interaction, overdose side effect that will actually affect the liver function. So best is to seek medical advice. Second is to reduce the free radical. So prevent oxidation caused by free radical. So long-term accumulation of free radical contribute to liver cell attack. So our body need a balance of free radical and antioxidant. So a good source of antioxidant would be fruits and vegetable, okay, such as brightly colored and green food. Example, berries, cherries, prune, broccoli, carrot, etc. Or alternative, you can actually take health supplement. Yeah. The third, it will be reduce consumption of barbecue food. So those are deep fried food and food that cook at high heat. Yeah. And try to take healthy and balanced diet. Yeah, that's the most important. And the fourth one will be exercise regularly. So exercise can actually help to clear the toxin waste through perspiration, urine generation, and gut stimulation. Yeah. Next. Okay, now we know that hepatitis is the world's most common liver infection. Let's look at what are the ways to prevent hepatitis B infection. Yeah. So first, we have to get hepatitis B antibody injection. But take note that, however, it is important to remember that the vaccination only works if a person has not been previously infected by the virus. Yeah. So second is the prevention start from the mother. Okay, for newborn mother, they should do hepatitis B screening 8 months before the pregnancy. Third would be, as for newborn baby, antibody injection should be done according to the schedule within 3 to 5 days. Example, within 3 to 5 days, newborns, month and month interval. So if the mother belong to a high risk group, okay, newborn baby should obtain the first antibody injection within the first 24 hours. Yeah. So the fifth is that do not share toothbrush, shaver, unsterile needle for acupuncture, tattoo, and piercing, because this one hepatitis B can actually transmitted through fluid, through blood transfusion and all this. Yeah. So try to avoid that. And the last one will be avoid unnecessary injection and blood transfusion in order to eliminate the risk of infection. Next. So treatment. Yeah. So to prevent for hepatitis A and B, we can actually go for vaccination. So for hepatitis C, until now, there's no vaccination for the prevention. So some medication may be prescribed by doctor for liver treatment. Okay, so for example, the alcoholic liver disease, there is the so-called L-ormate and how aspartate that will actually help to reduce ammonia in the blood. So actually high ammonia level in the blood can actually lead to serious health problem, yeah, including brain damage, coma, and all this. So yeah, so the third one will be for hepatitis A, no cure, but it can actually recover by letting the liver rest well within a period of time. So in most cases, it takes about 6 months to recover. Yeah. So for hepatitis B, it depends if it's acute or chronic. So if doctor determine the hepatitis B infection is acute, meaning it's a short-lived and will go away on its own, you may not need any treatment. But for chronic cases, the treatment may include some antiviral medication. Yeah. So like interferon injection treatment help to reduce the risk of liver disease and prevent you from passing the infection to others. Yeah. So for hepatitis C, it is treated using the direct acting antiviral, so-called DAA tablet. So this hepatitis C can often be treated successfully by taking medicine for several weeks. Yeah. Yep. So these are the treatment. Next. Okay. Next. What is Ganoderma? Okay. So Ganoderma is a kind of also called 灵芝. Is commonly known as 灵芝. Okay. It's a very special type of mushroom that has the healing property, and it has been recognized as a medicinal mushroom for over 2,000 years, and its powerful effect have been documented in the two oldest medical books in ancient China, 神农本草经 and 本草纲目. So in the last 50 years of modern scientific research in this so-called 灵芝, we can find many evidence-based reports published. So do a Google search, okay? You can do the Google search of the keyword 灵芝 or Ganoderma, okay? Or you can actually find many. So as of the latest update by Mr. Sim, is actually when you search a 灵芝, there is 1,004 okay articles published, yeah, in the so-called the PubMed website, which is this PubMed website is actually the U.S. National Library of Medicine. Yeah. So there are many evidence-based research published. Next. Okay, when it comes to selecting a 灵芝 product, you will spoil for choice in the market. So why would you choose Stronghold? So first, Stronghold is one of the world leader in producing top quality and reliable 灵芝. Their main core business is in researching, producing, and marketing 灵芝. Yeah. So the company has been in the business for 32 years, specialized in producing top-graded 灵芝product. Head office in Taiwan and named as Double Crane. So in the Southeast Asia region, it named as Stronghold. Yeah. So the company owns their in-house R&D 灵芝 farm as well as the distribution network. So through many years of research effort, with its patented extraction process, all 灵芝 products are extracted with the two unique components, terpenoid and micromolecular polysaccharide content. And the product have been certified scientifically with various endorsements, TQF, Taiwan Quality Food, Halal certified, as well as ISO certification. Yeah. Okay, now we look at what are the unique function and benefit of this Ganoderma, so-called 灵芝, that help in liver protection. First, there are 4 key functions. Okay, the first one, regulate immune system. So they actually simulate activity of immune cells to subdue hepatitis virus. Regulate immune system to prevent autoimmune attack to the liver cell. And so immune system must be regulated. It cannot be too high. Too high, it will actually attack our own organs, such as the liver. Too low, you will get infection very easily. Yeah. The second unique function is improve blood circulation. So 灵芝 is very good in removing blood fat, example cholesterol and triglyceride. So as a result, chances of you getting fatty liver will be low. Yeah. Third, enhance liver function. This is called so-called detoxification. So this unique function will actually eliminate toxin from the liver and promote regeneration of liver cell. Yeah. So based on evidence-based research, that our linker is able to do that very effectively. Later, we'll show you some of the research paper as well as the testimonial. And number 4, remove free radical and antioxidant and anti-oxidation. So reduce free radical from attacking the liver cell. So liver can be protected. So free radical actually can cause damage to DNA. They are linked to many diseases, okay, such as diabetes, heart disease, or cancer. Yeah. Next. Okay, now we know that linker is so unique, and then the reason why linker is so unique is that because of the 4 unique function and the benefit from the component. The 2 major components are terpenoid and micromolecule polysaccharide. So in particular to liver, terpenoid is the active component to enhance the liver function on detoxification. As for micromolecule polysaccharide, it is the active component to enhance the liver function and on the detoxification. And our linker has been affirmed by the Health Ministry of Taiwan accreditation, okay, certification. The reference number A0003 is a number reference. They have actually done the independent testing, and the ministry actually done the independent testing and awarded the following. Yeah, so the first one, immune system is actually help to promote the production of antibodies, help enhance the production of immune cell. They also modulate the function of T cell. So promote the vitality of natural killer cell and promote the vitality of phagocyte. So these are the immune cell system. Second is the liver protection. So they actually tested out that it's actually helped to reduce the indices of GOT, GPT. So this GOT, GPT must be lower so that liver function can perform well. So help to increase the protein content in the liver. So these are assurance that the product is effective in according to the so-called lab test. Yeah. So these are the accreditation from the Ministry of Taiwan, Health Ministry of Taiwan. Yeah. Next. Yeah. Okay. Here we will show you some of the research done by professor. The name is Lin Song Cho. Yeah. He's from Taiwan Medical University, who is specialized in liver disease. So there are many research papers he have done. The first one, he actually used the extract. The first one, he used the extracted micromolecular polysaccharide to evaluate the hepatic and renal protective effect of mice that has the liver damage. So he found that actually the Ganoderma extract could actually protect the liver and kidney from the so-called superoxide induced hepatic and renal damage, meaning they purposely induce the mice with a so-called liver death to actually induce the damage to the liver. Yeah, so and then using micromolecular polysaccharide to evaluate the effectiveness. Yeah, second is a study to look at the so-called the scavenging, meaning the clearing activity of the free radical and liver protection activity from a different species of Ganoderma. So there's one Ganoderma lucidum, which is a normal linker, and then the other one is the Taiwan purple type of linker, Famosanum, and the third one is from Japan. It's a Japan type of linker. So from the study, they actually found that the Taiwan purple color type of linker, okay, show the greatest liver protection activity and the greatest free radical scavenging clearing activity. Yeah. So the third one, they want to do an experiment to actually look at, actually they have done the experiment to look at the effect of Ganoderma lucidum against the liver injury. So this liver injury is actually purposely use a chemical to actually induce the damage to the liver. So the experiment is done on the induced damage that is similar to the damage by hepatitis B virus. So they actually make use of the mice to do this experiment. So the result show that Ganoderma lucidum has a significant protection effect, okay, in the so-called induced damage injury, especially when taking in high dose. So actually the high dose will have a good effect. So far they have done that. They actually show that there is a significant protection effect. Yeah. Next. So another research, number 4, another research is to look at the Ganoderma, which is linked on anti-hepatitis B activity. So actually the results show that the extracted gadolinic acid from the Ganoderma, which is linked, is actually able to stop the replication of hepatitis B virus. Yeah. So number 5, okay, another experiment is to look at the effect of Ganoderma lucidum on the induced liver fibrosis in mice. So they treat the mice with certain dosage, okay, and want to see the result of the GOT-GPT. And they found that the GOT-GPT is able to reduce, okay, with the dosage of 1,006 milligram per kilogram. They actually have this dosage feed to the mice. And they found that they are very effective. At the same time, they also find that the hepatic protein level is able to increase. So all in all, they are actually very effective in delaying the development of liver fibrosis. Yeah. Number 6 is that another study is to look at the Ganoderma on hepatic damage caused by so-called a toxin chemical. So this is a benzoaprine. So this toxic component can be actually found in tobacco smoke, many food when cooked in high temperature. Example, fried food, very high temperature, yeah, charcoal grill, smoked meat. So the results show that Ganoderma lucidum extract is able to restore the antioxidant defense and prevent the hepatic damage caused by this chemical. So all show a good result, yeah, when using the Ganoderma treatment on the liver disease. But this is done on the lab, in the lab. Yeah. So next. So in summary, the key takeaway from all this research, okay, is that Ganoderma is able to protect liver from the induced damage. Okay, second, inhibit the replication of a hepatitis B virus. Yeah, the third is that the lower the GOT-GPT liver enzyme level. So when you lower that level, means your liver function is performing well. So fourth is to increase the liver protein level. Fifth is to protect the liver from toxin chemical damage. Yeah. Next. Next will be more Ganoderma research, but based on animal testing, focusing on liver diseases. So this is the research based on animal testing. So the Ganoderma lucidum, what they see is that it can reduce hepatitis B virus activity and also slow down the so-called the viral replication and reduce inflammation response as well as lower the GOT-GPT level. Yeah. So next, another research. Next. So another research, they actually looking at Ganoderma lucidum. Okay, see, is there a way that they actually can stop the liver from inflammation due to hepatitis B? So the result came back is that they are actually quite good. Both Ganoderma acid and because of active component micromolecular polysaccharide can actually effectively stop hepatitis C virus from replication also. Yeah. So the next research is to look at how Ganoderma can suppress the liver cancer. So this is a story. This is the study actually using animal testing model. They actually show Ganoderma can actually suppress the liver cancer and has the inhibitory effect on the spreading of cancer cell. Yeah, it's a liver cancer cell. Yes. So next we look at the dosage. So based on the Jungian Ganoderma, the dosage for prevention is 4 to 8 capsules a day. Yeah, and for therapeutic at pre-illness level, it is 12 capsules and above. Yeah. As for mega dose level at cirrhosis and liver cancer stage, so it will be 30 capsules and above. So when first taking the Ganoderma, different people may experience different reaction, and we call this as vertical reaction, and it is temporary for a few days to weeks. Yeah. So for liver disease, you may actually experience hiccup or vomiting. Yeah. So these are some of the reactions that you may face for a person who actually starting off with taking Ganoderma. As for cirrhosis, stool color may change. Okay, may actually have may come up with some blood stain. Yeah. So this one no sign of concern. It's just temporarily. Just have to monitor. Yeah. Next. Yeah. Now, in TCM, okay, theory, liver is governed by our emotion. Example, anger, depressed, mood swing. Okay, so TCM believe these are excessive energy, and it can actually affect both the liver and the gallbladder. So indirectly, your digestion also will be affected. So liver is also associated with eye, according to TCM perspective. They associate liver is also associated with eyes, tendons. So when liver is no good, your eyes and tendons will be indirectly affected in some way. So the key takeaway is to manage your emotion and eat more fresh food, okay, for the liver. Example, basil, celery, and listed over here. Yeah, the cucumber, etc. So these are the few fresh food that we can actually consume, good for liver. Yeah. Next. Okay, this is a very interesting finding from the three scientists actually who got the Nobel Prize for their achievement on discovery of a molecular mechanism controlling the circadian rhythm. So their discovery actually explained how plants, animals, and humans adapt their biological rhythm so that it is synchronized with the Earth revolution, okay, Earth movement. So circadian rhythm have an important purpose. They prepare your body for expected changes in the environment. And for example, the time for activity, time for sleep, and time to eat. So they found that there is a circadian clock in our body to actually regulate all the critical functions such as our behavior, hormone level, body temperature, and metabolism, etc. So in fact, okay, in fact, Chinese TCM back in ancient time also have a biological clock, but it is associated with organs. So it is based on qi energy moving through the organ system in 24 hours clock cycle. And interestingly, Mr. Sim had actually combined the Western circadian rhythm clock with the Chinese TCM organ body clock. So you look at the picture, see the picture, and we can actually view it in the TCM perspective, yeah, from the rhythm clock, yeah. So for example, in the rhythm clock, okay, the so-called circadian rhythm clock, 11 p.m. to 1 a.m., which is okay cross midnight. So this is the time what for sleep and regenerate. This is according to the circadian rhythm clock. It's time to sleep and regenerate. Okay, so when in TCM clock, at this time, if we look at it, the affected organ is gallbladder. In order to wake up feeling energized, the body should be at rest at this time. So otherwise, you will actually have your emotion will actually be affected the next day. Okay, show in resentment. So in the rhythm clock, another example is in the so-called circadian rhythm clock, from 1 to 3 a.m., we should be in deep sleeping mode. Okay, so-called resting and dreaming. Yeah. So in TCM perspective, at this time, the affected organ is liver. So this is the time toxin are released from the body and make fresh new blood. So if you are still awake, you could have too much problem with your liver or detox. Yeah, the pathway. So the end result could actually show in your so-called emotion. You have anger, you get agitated easily, you get frustrated very easily the next day. So the key takeaway from this slide is that we need to go to bed early and sleep by 11 p.m. and do not stay up late. Okay, this is no good for our liver and gallbladder. Yeah. Next slide. Okay, some other product from supplement product from Stronghold can be considered. Okay, so lactoberry example. Lactoberry actually protects the liver against effect of alcohol. So a new study actually suggests that probiotic can actually improve not only the health of our gut but liver health as well. So many animal experiment and clinical trial show that probiotics are effective for the treatment of alcoholic liver disease. So our stronghold, so-called lactoberry is unique. That is encapsulated with multi-coated technology, which allowed the probiotic to actually travel effectively all the way to the gut. Yeah. So the next product will be Jaho fiber. So Jaho fiber is actually support the metabolism of blood, cholesterol, and triglyceride. So thus stopping them, they are built up in the body. As a result, it actually helps to prevent fatty liver. Yeah. So other products such as lutein, tea, bee pollen are also a good choice to be included for the holistic wellness. Yeah. Okay, now we look at the testimonial. So, okay, this is the testimonial from Taiwan. Okay, uh, Mr. Lee. Okay, had high blood pressure. So at 41, back in 2010, he diagnosed with 50% blockage in the artery, and he's a type A personality that made him a very competitive at work and very work obsessed, very so-called workaholic person with high pressure at work for a long time. He got his heart disease that required to take blood pressure medication and aspirin. So together with this so-called Western medication, he started to take 4 capsules of linzer, together of 4 capsules of bee pollen before meal. Okay, so for 3 times per day. So 6 months later, his pressure actually dropped to so-called 120/90 level. He started also include to actually change his lifestyle by including jogging, taking more time to rest. Okay, so adjusted the lifestyle, so his condition improved. So by taking linzer and bee pollen and actually continue, okay, for that. So back in 2017, okay, 2 years before 2017, he actually stopped the Western medication. Okay, he only actually taking linzer and bee pollen, and with the so-called healthy lifestyle, he's actually systolic pressure remain at 120 and 130. Yeah, so his condition improved and always show good result in his routine medical review. So he was quite happy. So in fact, because of his confidence in the linzer, he actually shared with his wife and encouraged his wife to take. So to continue with this testimony, another testimony is from his wife. Okay, so his wife actually is a hepatitis B carrier. So he knew that his wife is in a high risk group because what? Because her mother and grandmother were also a hepatitis B carrier, and both so-called their mother and grandmother passed away because of hepatitis B virus infection. I'll continue to the next page on the next. So the next page is also the same testimonial. Continue from here. Yeah. So so uh, so Mrs. Lee, so-called the wife, started to actually consume 灵芝 and bee pollen and lactoberry every day. So her dosage was every day 1 sachet of 灵芝 and 1 sachet of bee pollen. So she also take lactoberry before every meal. Okay, so she'd been taking this same dosage for 2 years. So after 2 years, because of she went back to work, okay, and her new employment required her to actually go for health screening. And to her surprise, that the report came back confirmed that she is no longer a hepatitis B carrier anymore. So the family was very happy to learn that 灵芝 not only helped to protect her liver, which is initially she thought that the plan was just to protect her liver, but it also cleared the hepatitis virus that has been with her since born. So the key takeaway is that 灵芝 not only able to protect the liver, but long-term consumption with the right dosage is effective in reversing the liver condition of a hepatitis B virus carrier back to a normal condition. Yeah. So next testimonial. Okay, so this is another testimonial, but this is a testimonial of a 73-year-old so-called woman back in 2017, Madam Lau from Taiwan. So when she's at a younger age, 48-year-old that time, she actually had a hepatitis B virus infection and went for interferon, so-called that medication, so-called interferon therapy, but it's not effective because got side effect that actually causes her GOP GPT went up very high. Yeah, so the doctor stopped the treatment, and then without further treatment, okay, she actually live it normally, and without the treatment, any treatment from there afterward, for 19 years. So without her knowledge that her liver has already started to get inflamed progressively, going from fibrosis to beginning stage of cirrhosis. So at that time, at the age of 67, okay, after 19 years, she actually diagnosed with the early stage of cirrhosis. Yeah. So because at that time there's no treatment for her already. At the age of 67, she cannot take interferon, so-called therapy. So she actually started to take 灵芝 with the dosage is 10 sachet of high concentrated of 灵芝 and 10 sachet of bee pollen every day, okay, for 2.5 years. So after 2.5 years, she managed to actually reverse her early stage cirrhosis condition back to normal. So the key takeaway is long-term consumption of high dosage of 灵芝 with bee pollen can actually improve the early stage cirrhosis liver, okay, back to normal condition. Yeah. So with 灵芝 actually give her the chance to actually let the liver grow back. Yeah. Next testimonial. Okay, so this is another testimonial from Taiwan. So this is a case of initially from hepatitis B virus turned into liver cancer. So he actually took so-called very high dosage of 灵芝. The liver cancer disappeared after taking half a year of high dosage of 灵芝. So the dosage is YK2 equivalent of 灵芝, 1 sachet. Okay, B pollen, 1 sachet. He take 4 times per day. Okay. In addition, he also take YK1 equivalent of 灵芝, 5 capsules every 2 hours. So this is the so-called dosage that he's taking for so-called half a year. Yeah. So with this so-called high dosage, he actually managed to actually get rid of the so-called the liver cancer. He through the checkup he can't find any cancer. Yeah, from there. So he actually started to maintain his dosage but at a lower dosage. So for maintenance, he actually continued the 灵芝 dosage as 10 capsules of YK1 equivalent of 灵芝 and one sachet of YK2 equivalent of 灵芝. Yeah, this is how he maintained. So he actually take this, continue, yeah, no relapse after 5.5 years. So the key takeaway is that 灵芝 not only good in improving the liver function, but it also has an anti-tumor effect. Yeah. So next slide. Yeah. So this table shows patients with hepatitis B carriers have very good result after taking high dosage of 灵芝. So and B pollen. So many cases of patients with hepatitis B carrier being cleared of hepatitis B virus, yeah, after a few years of taking 灵芝 with the so-called dosage. Yeah. So next. Yeah. So some cases of liver in this table, they show some cases of so-called liver cirrhosis, liver tumor, and fatty liver. They actually have a good outcome after taking 灵芝 for a period of time. So they continue to take 灵芝, even their overall condition improve. So as we can see, that different people may have different short-term reaction from sleepy, smelly to stool, diarrhea, itchy eye, and all these kind of reaction. So it's very much depend on individual health condition, underlying health condition. So important is that have to continue taking the 灵芝 consistently until they get good result. And the key takeaway is that dosage and the long-term consumption of 灵芝 that help to improve the liver condition. Yeah. Yes. Here come to a conclusion. Yeah, the key takeaway is the liver is the major detoxification organ in our body, and they are also very silent and hardworking organ. Continue working for 24 hours without complaining, and when you get damaged, without we knowing. So most of the time, we do not know we have this so-called the liver disease. So and the thing is that the progression of liver disease might actually lead to deadly condition of liver cirrhosis and cancer. So it's very important to maintain a healthy lifestyle. For example, sleep early, don't stay up late, and at the same time, exercise regularly, eat healthy diet, get vaccination, and go for a regular checkup. And not to forget, okay, include Ganoderma, so-called 灵芝 as a supplement, as it helps to prevent liver disease and its complication. Yeah. So with that, I end my presentation. Thank you, everyone.